Hi, and welcome to another episode of Let's Talk About It with PsychHub, where we explore common mental health topics and answer questions. I'm Dr. Whitley Lassen, and I'm so excited to be joined by Dr. Torrey Creed. Torrey is a licensed psychologist, an assistant professor at the University of Pennsylvania, and the director of the Penn Collaborative for CBT and Implementation Science. Welcome, Torrey.
Thank you. I'm so happy to be here.
Today we're going to be talking about psychotherapy. This is a really common question, and people want to know what they're getting themselves into if they're going to seek treatment for mental health, and specifically if they're going to go to therapy. So, Torrey, can you tell us what is psychotherapy?
So psychotherapy can look a lot of different ways depending on the choices that someone makes. Different therapists will deliver therapy in different ways, but there are some pretty reliable things you can depend on in terms of what psychotherapy is going to look like. So first of all, you're going to be working with someone who is a trained professional where their goal is to use strategies and skills that they have used to help you identify goals that you want to work toward, and then offer support or strategies that are going to help you move toward that goal. I would say that therapy might fall into three different categories. There's individual therapy. There's therapy that is either family or couples therapy, so where you're going not just by yourself, but with people who are close to you and are members of your family or partners that you're in a relationship with. And then the third category would be group therapy. So there you're also in the room with other people in addition to the therapist, but you are folks who have all come together with a goal of working toward wellness or health or resilience.
I think it's really important, Torrey, to talk about who can provide therapy. There's a lot of different types of therapists out there. Can you help answer that question for me?
Absolutely. And that's a really important question because it also helps to differentiate between things like what is therapy versus what is something like finding a life coach, and what are the differences. So when we're talking about psychotherapy, we are talking about a treatment that is provided by someone who has graduate level training in counseling or psychology, social work, it might be psychiatry. So things to look for when you're looking for someone to provide therapy are someone who has, as I said, graduate training in counseling, psychotherapy, social work, or psychiatry. And that person should either have a professional license in delivering those skills, or sometimes, depending on the context where you're finding treatment, you may be receiving treatment from someone who is not yet licensed, but is supervised by someone who is licensed.
Thanks for clarifying that, Torrey. Another question that I hear a lot is about confidentiality, and is therapy really actually private?
Gosh, that is so important, and I think it speaks to one of the things that people sometimes worry about when they're seeking therapy is that they are looking for someone to talk to about things that are distressing or difficult or confusing, and they're worried about privacy. It's a really important issue. I'm glad you raised it. So first of all, the starting point for therapy is that it is meant to be a place that is safe for you to talk about vulnerable or complicated things. So the starting point expectation is that it should be private. There are some exceptions or pieces to think about, which I will touch on here briefly, but I think it's a really important early question to raise when you're looking for psychotherapy. You can, even as you're looking for a therapist, call someone ahead of time and ask them a few questions rather than just signing up for an appointment. And this might be one of the early questions that you ask, is about how they think about privacy and confidentiality. So a couple of limitations to the rule about things being private. First of all, are if a client, whether it's you or a child that you're seeking help for, if someone confides in a therapist about information that means that someone is at imminent risk of harm, the therapist is going to be obligated ethically and legally to share that information. And so sometimes that worries folks because, for example, they're having thoughts about death or dying, or they're in a situation where their safety is at risk and they feel like they can't go talk to someone because it's going to be outed. So that's a really great conversation to start by having with your therapist. The rules around that are intended to keep people safe, whether it's that someone themselves is at risk of harm or they're at immediate risk of hurting someone else. But a skilled therapist can help navigate that complicated piece between I need to talk to someone because I'm in this distress and I'm worried about how it'll be shared. So that's one of the first limits that I want to name, is that the biggest priority is that folks stay safe, and that can sometimes lead to limits and confidentiality. Other pieces to think about: your therapist will keep everything else private. And I described the fact that therapy can look like different things, including other people being in the room besides you and the therapist. For example, if you're going to couples counseling or family therapy, where folks who are part of your immediate circle will be in the room with you, they're not legally and ethically bound in the same way your therapist is. So you want to have a clear conversation in therapy about how you as a group will manage privacy. In group therapy, one of the first things that should happen in your first session is a conversation about confidentiality and how you as a group will agree on keeping things private, with transparency about those couple of limits. Beyond that, therapy is really intended to be a safe spot for people to share even really vulnerable things.
Torrey, you brought up some really good points here, and I also want to just clarify that therapists do take your privacy very seriously. So if you run into your therapist at the grocery store or out in the community, they are not going to come up to you and talk to you out of respect for your privacy and your confidentiality. So that's another thing to talk about with your therapist as you're beginning treatment.
Thank you for raising that. That's such a good point. By not approaching you first, your therapist is protecting your privacy. But often when you talk to your therapist about that, they will say something like, but if you want to say hi to me, that's totally fine. And that reflects that bigger picture idea of the fact that your therapist will err on the side of caution to protect your privacy, and that you are in control of what gets shared, including whether you and your therapist are going to acknowledge each other in public. That's a great point, Whitley.
What other kinds of questions should people ask if they're trying to decide if a specific therapist is the right fit for them?
Oh, I'm so glad you asked that. And in fact, I think that oftentimes it doesn't occur to people to start by asking questions. I think folks find someone who offers therapy, make an appointment, and jump in. So I think there are a number of other questions that you can ask, some of which are very practical questions and some of which are about finding fit. So practical questions that you might want to ask are things like, for example, do you take insurance? And if so, do you take my insurance? Questions like, what happens if at the last minute I can't make it to a therapy appointment? What will happen? Because, for example, sometimes if you cancel at the last minute or just don't make it, therapists may have sort of a guiding rule about what that means. So you want to ask those kinds of practical questions about, like, what does this process look like? But maybe even more importantly are questions that people might ask that relate to fit. And so those kinds of questions might be, for example, first of all, about the kind of therapy that this therapist provides, or how they think about or describe therapy and its goals and the way therapy works. So one way, sort of a category of answers that you might get, has to do with something called evidence-based practices, which is really just sort of a jargony term for therapies that we know work. So evidence-based practices are kinds of therapies that have been studied in research studies, and where we've found that compared to sort of a general supportive therapy relationship, when a therapist delivers certain skills or strategies or takes a certain approach, that clients get closer to their goals more quickly. So you can ask about things like, do you offer an evidence-based practice? And if so, what is it? Common evidence-based practices that you might hear about are things like cognitive behavioral therapy, dialectical behavior therapy, prolonged exposure, cognitive processing therapy. There are many. And in fact, if you Google evidence-based mental health practices, you'll get information about what they are and what they might be a good fit for. Another direction that you might ask about in terms of fit has to do with asking your therapist about what the therapy process looks like. You will hear some therapists who talk about therapy being sort of an open-ended relationship that's a safe space to talk. Other therapists will talk about things like having skills that they'll teach you to help you move toward your goals. Some therapists will talk about practices of skills you might use between sessions. Other therapists have the focus of the work happen in the room. So asking about what would therapy be like is a good question. And maybe the final one I would suggest is asking a therapist about whether the things that you want help with are things they have familiarity treating. Because different therapists have different areas of expertise, just like any other professional. And so if you are looking for support with, for example, marital issues, you want to make sure that your therapist has experience working with those kinds of problems, versus if you're looking for support after a trauma or you're looking for support related to depression or anxiety.
I think that's a really good point, Torrey, that you want to be asking about fit. And you want to make sure that the therapist is a good match for you specifically. Not every therapist is going to be the right fit for every person. That leads me to think about another question. How would you know if therapy was working, and what would you do if it doesn't work?
So I think that that's going to be different for different people, but I think that there are some rules of thumb that might be helpful to have as a frame in your mind for asking yourself questions about whether therapy is working. One way of thinking about it is to be clear in your own mind about what your goals are in therapy, what it is that you're coming to therapy hoping to understand differently or functionally be different in your life or achieve or move closer to. When you have a really clear picture in your head of, for example, what you want more of in your life or what you want less of in your life or where the areas of distress is that you want to have be different, it's very helpful, I think, to keep an eye on that as you're moving through therapy to make sure that you're seeing a change in the things that really matter to you. So describing it that way, I think, is thinking about it as a bit of a subjective process, which makes sense, right? You're the one who's experiencing the distress or has the idea in your head about what you want to have be different. And so you are the best gauge of whether you're moving toward those goals. And also a question goes back to questions you could ask your therapist, is this could actually be a conversation you have with your therapist, is after you've talked about what you want to work on, having a conversation to say, how will we know if I'm making progress? Like therapist, how do you think about it in terms of what progress looks like? You may hear answers about asking about what you yourself perceive to be changing. You may also hear answers about things like questionnaires or standardized measures. Essentially what those are usually a brief measure. It might be like 5 questions or 10 questions that you answer periodically that becomes sort of like a measuring stick that you are holding up against your goals to see whether you're moving toward the things that matter to you. Because therapy can be a little bit of a long process sometimes to move toward the goals that are important to us. And so sometimes change is slow and it can be hard to see from just that subjective place. But if you have a measure, let's say of depression, because that's what you're working on in therapy, and when you first start coming to therapy, you're getting scores like 10 or 15 on a scale of 20 about how depressed you are. And after a month or two, you're coming in at like 11 or 12 each week. It might be hard to see that subjectively because the difference might not feel dramatic, but if you can have that more objective measuring stick, that can also help you have a sense of whether you're moving towards your goals.
Thank you, Torrey, for helping us understand a little bit more about what therapy is. If you're looking for a therapist, we have some recommendations. You can call your insurance provider, find your local community mental health center, or reach out to the Association for Behavioral and Cognitive Therapists at findcbt.org/FAT, or the Academy for Cognitive Therapy at academyofct.org. Be sure to subscribe, follow us on social media, and visit psychhub.com to learn more about our Mental Health Ally certification and our CBT courses for mental health providers. Leave us comments with questions and suggestions on what you want to learn more about. Thank you, Torrey, for joining us today. I really enjoyed hearing from you and learning more about therapy.
Thank you so much. It was really a pleasure.